Hi, everyone. Thanks for joining us tonight on the Celeste Williams for Arkansas page. I'm going to give everyone a minute to join the before we jump in with questions for tonight's virtual town hall. Tonight, we're going to be covering reproductive health and reproductive health policy. We're joined tonight by Celeste Williams, a nurse practitioner and Democratic candidate for U.S. Congress here in Arkansas's 3rd District. And a special guest with us tonight is Michelle Green, a nurse practitioner who specializes in women's health. So while everybody is joining the broadcast, I want to remind everyone that if you do have questions tonight, you are welcome to drop them in the comments. I will be monitoring them the best I can and try to get to as many questions as possible. We also had several that were pre-submitted that we're going to be addressing as well. So we'll just give everybody a minute to get started. While people are joining us, let's go ahead and let our guests introduce themselves. Celeste, would you please introduce yourself to everyone and tell us a little bit about your background and why you're running for Congress?
So I am Celeste Williams, and I'm a family nurse practitioner and the Democratic candidate for U.S. Congress here in Arkansas's 3rd Congressional District. And I am running for Congress because I want to make sure that nobody goes broke just because they get sick, that we have a world-class education system, and make sure that workers in America are paid a fair wage. And a lot of my impetus for wanting to run was seeing the problems that many of my patients face. And, you know, those were problems that I could not solve in an exam room. And I think that it is really important that we have someone in Congress who is representing the everyday people here in Arkansas that, quite frankly, I do not think have a voice that represents them right now.
Thank you. Michelle, would you like to introduce yourself and tell us a little bit about your background and what it is you do here?
I'm Michelle Green. I'm a APRN, a nurse practitioner, women's health nurse practitioner at Vector Health and Wellness here in Fayetteville. I've been a nurse for about 15 years, and I've been an APRN, women's health APRN, for about 5 years. I worked at Planned Parenthood. I've worked at the health department as a nurse, Planned Parenthood as a nurse practitioner, and then we opened Vector Health and Wellness because we saw a need for reproductive health without judgment in the city of Fayetteville and the surrounding areas.
Thank you. Well, we're going to jump right in. Our first question that was submitted ahead of time is, what has your time as a healthcare professional taught you about seeing people as human beings, regardless of the services they need and the beliefs they hold? Celeste, let's start with you.
So I would like to just say that I see a big need to make sure that we are caring, that a person is able to get the care that they need for them to do well in life. And certainly good health is a good foundation for anything else that they want to do, whether it is, you know, a child having their asthma well managed to function and learn in school, to an adult who can't get the blood sugar controlled to be able to function well at work. And I think that healthcare needs to be a place that they do not feel judged, that they have a safe relationship with whoever is providing their care. And I think that as a nurse practitioner, it has always been very important to me to meet them where they are and make sure that they're able to kind of set their goals for their healthcare needs, whether it is being able to attend a grandchild's graduation or wedding or whatever it is, and then setting those goals to where they can stay healthy to do those things that are important to them. And that requires a very holistic approach and making sure that they are in a safe environment at home and able to get all their basic needs met.
Michelle, would you like to answer the question as well? Just a reminder for our listeners and viewers. The question was, what has your time as a healthcare professional taught you about seeing people as human beings, regardless of the services they need and the beliefs that they hold?
Well, healthcare in general really teaches you that everybody is different. Everybody has their own upbringing, their own beliefs when it comes to healthcare, when it comes to what they believe that they're able to do as far as healthcare, and that changes over a lifetime. So it's important to be really flexible with people in healthcare, be really compassionate and understanding. And I agree with Celeste, meeting people where they are, no matter where that is very important. There are people who have to choose between medications and food. There are people who, are able to take medications for a short period of time because they have that extra money, but they're not going to be able to do it in 3 months. And it's so important for healthcare to be available to everybody. And it's one of those things that I very strongly believe in, that we should be able to take care of everybody, and there shouldn't be that question of medicine or food. And educating people is another thing that's really individualized. So I feel like education is super important when it comes to meeting people where they are and creating healthcare goals that not only meet like the criteria for the medical provider, that the things that you have to do to make sure that someone's safe, but also to help that person meet their personal goals as well.
Can I jump in real quick and say, I think sometimes we talk about like social determinants of health, and we don't really define what that is. And, what that looks like for one person might be that they live in a neighborhood where they live in a food desert, where they can't get fresh, healthy food, or that they don't have a job that allows them to meet their basic needs, or allows them to buy foods that are more healthy, or that allows them to buy the medications they have been prescribed. Or maybe they don't have the transportation to get to their appointment to see their healthcare provider. And really kind of looking at barriers that certain communities have to help improve the quality of life for that individual as well as the people in their community. And those are, again, what I was kind of saying from the beginning, those are things that we can't fix in an exam room providing care. Those are policy problems that have to really address making individuals and communities and families stronger.
So thank you everyone for tuning in to tonight's virtual town hall. As you guys know, if you read the event, tonight's theme is reproductive healthcare and reproductive healthcare policy. So we're going to jump right in. Celeste, do you favor upholding the Roe v. Wade decision?
I do, and I certainly think that there is no mystery in what causes unwanted pregnancies. And so really we need to stop the pro-life versus pro-choice debate that we've been having for over 40 years now. And we really need to focus on prevention. Certainly as a healthcare provider, I would always rather prevent rather than treat. And again, there's no mystery in what causes that. It is making certain that women have access to the contraception of their choice. And I also think that, even just saying that, I also am not acknowledging that men are the other half of how unwanted pregnancies are created. And so making sure that sexually active people have access to the contraception of their choice. And actually, I should even further that with quality, reliable contraception. And then make sure that we have age-appropriate, evidence-based education. And I think sometimes as parents, even myself, I feel a little bit uncomfortable with, well, what is being taught to my child by whom? And by evidence-based and age-appropriate, that starts early And it's not just sex ed. It is, you know, if a child in a quality pre-K program is being exposed to different jobs and goals that they might want to aspire towards in life, and as they grow and in school years, to really start to see themselves and their future and have hope and optimism, and to value themselves, and, you know, that instilling that self-love and self-value really makes you more likely to make better choices, and to have the knowledge that you need to make those good choices, to prevent unwanted pregnancies, to prevent sexually transmitted infections, all of those things, and to help you, you know, all of those issues are really interrelated.
Okay, my next question, I'm going to direct this to Celeste first as well. The anti-choice movement has branded themselves as being pro-life.
Mm-hmm.
Do you think that being against abortion is the same thing as being pro-life? And what policies do you consider to be truly pro-life policies?
So I balk a little bit at just that terminology. And I think that certainly the abortion issue has been used as a wedge to divide this country. And it creates this false narrative that there are only two ways to see this issue. And the reality is that most people are not pro-abortion. Most people are, and it also creates this anti-woman, anti-baby narrative, which is also not the reality. And so what I think is very important is that we move away from this conversation of criminalization towards reducing the need for an abortion. And, you know, the number one reason that a woman chooses to have an abortion is financial. And so what does that say about us as a society if we are creating a community where a woman does not feel that she has the support that she needs, whether that is a job that pays the bills, or affordable child care, or maybe help for her special needs children, other child. And I think that really making sure that we are creating a relational community where we value one another, that we make sure that people have opportunities for success, is the most important thing that we can do to reduce the number of abortions. And then again, it comes back to prevention and making sure, you know, we have good news on that front. When the Affordable Care Act was passed, the number of abortions that women had decreased because there was an increase in access to health care. And it is really looking at those policies to make sure that we are creating opportunities for families to do better. And that's certainly a woman's choice as to when and if she will choose to start a family, and making sure that there is justice so that all women have these same opportunities.
Michelle, from your perspective and what you see in your clinic as a nurse practitioner who specializes in women's health, what policies do you consider to be pro-life policies, and what would help the people that you're seeing every day?
I think any policy that would increase education would be very important. Anything that would decrease the barriers for birth control and even for abortion. Just knowing that that's there. Some women, because I've worked with people who have had abortions for many years, and a lot of women, just knowing that the option is there, just knowing that they don't have that additional pressure of having to figure out, okay, where am I going to go? What am I going to do? Sometimes people decide not to have an abortion because that option is available to them. So they don't feel so stressed out about it. Education is probably the biggest thing. And by education, I'm not talking about just sex education, but how your own body works. A lot of people come into a clinic without really understanding how they became pregnant. I mean, yes, they understand that I had intercourse and this happened, but they don't really understand the timing involved. They don't understand how birth control works, how important it is that you take it according to how it's prescribed. So really, education is the big thing. I think that's the most important thing.
I am sure, Michelle, that you've had that experience that someone asks you a question about, can I get pregnant this way? And you just think, oh my gosh, yes, you can. And I am so glad that you're not right now. And, it's like that lack of just how your body works knowledge is sometimes really surprising. And again, that's one of those situations that you want to make sure that that person has access to a healthcare provider who will answer that question without that internal, without saying, oh my gosh, I can't believe you didn't know that. That they feel safe enough to really ask those questions, because there is no dumb question in those situations. You want to make sure that each woman has the knowledge that she needs to make good choices about her body.
Yes.
An extension of that question on the same realm, when we're talking about policies that will reduce abortion rates, what are some of those policies that will reduce abortion rates but will also not infringe upon the rights of women?
So I'll start with, I'll just talk about access to healthcare would certainly be number one, and the contraception of her choice. And then I also think that needs to be expanded to issues like equal pay, paid time off, and actually I would just say not just maternity time, but also like parental leave, so that men and women can have equal time off to care for the basic needs of their family. And so it's not just contraception that we're talking about. It is really creating, let me not say creating, but strengthening families, communities, and individuals so that they can have the best opportunity for a financially stable life and hopefully, a successful life, however they define that.
So building on that, Michelle, I'm going to start with you this time, and then we'll come back to Celeste to delve deeper into the policy issues. That's the next question on the list is, while this debate about reproductive justice is raging on seemingly on the political sphere, there are health issues that are talked about less frequently, but that are related to comprehensive reproductive health care. And they're very important to women's health. What are some of those issues that you see in your clinic that need more attention?
So general well person care, just getting screening paps regularly, getting mammograms as you're able to, just being able to get into your provider's office if you're having symptoms. That's pretty huge. And a lot of women have a really hard time getting into their provider's offices if they're having any kind of symptoms, or it takes a long time to get in. And just honestly, being able to get in touch with somebody to talk to whatever symptoms you're having. Also, regular STD testing is very important. It's something that some providers don't offer regularly, but it is very important to have regular STD testing.
Celeste, do you want to speak to that as well? What you would consider comprehensive reproductive care?
So I certainly would echo what Michelle has said. And I just think that, we have to, I do think, like, just thinking of this pandemic that we're all living through, I think that there are opportunities here, such as like telehealth, that do make it easier for someone who may have transportation issues to get the care that they need when they need it. But I also think that then also highlights the problems that women in rural communities have, where often they do not have access to broadband, or, you know, maybe they have a lower paying job and can't afford the gas that it takes to get all the way to the clinic. And so then what do they do? And so, you know, I think that it is really, again, making sure that we have access or opportunities in every community, no matter where you live. And one thing that I do think about as well is our maternal mortality rates. You know, we're like globally, the United States is ranked around 45th, and nationally, Arkansas is 45th or 46th, somewhere in there, for the highest maternal mortality rate. And, you know, again, that does come back to a lot of those social determinants of health, where if you live in a community where you do not have opportunities for good paying jobs, that you don't have access to quality health care, that really reduces your opportunities to have a healthy pregnancy. And making sure that a woman can get, you know, if you have to drive an hour to get prenatal care, that's really hard, especially when you are maybe working in a very low income job, and getting time off from work and money for transportation and those kind of things. And, you know, oftentimes the group that has a higher maternal mortality rate, they're also the same group that has a higher rate of child death. And so it is really, you know, it is very holistic and inclusive to think about making sure that we have safe communities. And, you know, to just be quite open and frank about it, it is more often than not African American communities in which we have the highest maternal mortality rate. And, you know, a lot of other you know, Black and brown people are also in that same group. And it's not because of underlying health. Those underlying health problems are created because of the way our society is structured and the opportunities that are unequal for different groups of people.
Okay, our next question comes in from someone who's viewing right now, and this one is a question for you, Celeste. Mm-hmm. What's the difference between you and your opponent, our current incumbent representative, Steve Womack, when it comes to birth control and health insurance costs?
So Steve Womack has voted 54 times to repeal the Affordable Care Act without a replacement. And I remember what it was like before the Affordable Care Act was passed. As a young woman, I was not able to afford health insurance that covered maternity care. And, you know, that makes it really hard to get access to contraception. And then, you know, as a young woman, that was sort of my biggest fear of, like, what if I get pregnant? How am I going to pay for that? And, you know, we don't want to go back to that time. And I want to make sure that we are able to expand who is getting the care that they need. And I would certainly, I don't have to, I mean, he's not going to support anybody for any reason getting an abortion.
Michelle, can you tell us a little bit about what you notice in your practice when it comes to a lack of knowledge and lack of accurate information available to your patients?
I've seen quite a lot of people who do have a lack of information about just general health care, how the body works, digestion, menstrual cycles. So that's kind of a large void of knowledge. So we just try and educate them as much as we can. I will say we've had quite a few people who have complained that they had abstinence-only education and just really did not understand how conception worked, or, you know, how to even find out if they were pregnant. So that's.
And Celeste, this is a two-part question, and building on that, exactly, what policies can we do? What can we do to ensure that our youth and adults have access to accurate, unbiased information about sex, sexuality, contraception, consent, so that they can remain healthy and make smart choices?
So this is, again, where it comes back to evidence-based education, and age appropriate. So it is not necessarily the mechanics of sexuality, but making sure that someone has the knowledge that they need. And certainly it is true that if you are abstinent, you are not going to get pregnant, and you are not going to get a sexually transmitted infection. But just like in the coronavirus pandemic, if you stay home, your risk of getting the coronavirus is much, much less. Yet people are choosing to go out into the community. And so how can they do that more safely? And in the coronavirus, it is wear a mask and reduce the number of people that you are exposed to and keep your distance, which is fairly similar to the education that one would provide for sexual education as well.
Thank you. Is there specific federal legislation you're aware of that would help establish nationwide sex education?
I think that there is a bill. I do not remember the number off the top of my head, and it does have bipartisan support. And certainly I think it is important to use existing legislative proposals, especially whenever they are supported by both Republicans and Democrats. And certainly reproductive health and reproductive justice are not issues that are just Democrat or Republican. It is really a public health issue and an individual health issue, and making sure that people have access to the care that they need when they need it.
I'm going to remind our viewers that we are about to wrap up soon. So if you have any last questions, go ahead and put them in the comments pretty quickly so we can try to get to them. Celeste, do you think it's fair for women to have to pay more than men for out-of-pocket screenings and contraception costs?
No, women did not get themselves pregnant. And, you know, there are certainly health issues that only affect men. There are some health issues that only affect women. And if you want to have a just and equitable society, then you need to create opportunities for each to be treated equally, and also not to punish them for being different. And I think that the differences between men and women should be embraced and celebrated. And certainly our policies can reflect that and create a more equitable system.
Okay, I'm not seeing any additional questions come through, and we're almost out of time. So I would like to give Michelle an opportunity to say anything else that's on her mind, or whatever you want to say for closing, Michelle.
No, just I appreciate the opportunity to be here and talk to everybody. And thank you, Celeste, for running. I'm just so excited that there's a nurse practitioner and someone who's on the ground and like boots on the ground for a long time, looking to take care of people and the community.
Thank you.
Oh, I do see one more question. Okay, so there's a question here. I'm going to take this one last question. Celeste, it says, since there have never been any national studies on the effects of birth or prenatal with newborns and a mother's usage of marijuana or secondhand marijuana exposure, do you have a position on that?
I certainly, so I'll just say as a healthcare provider, no one is going to do a study on pregnant ladies to see what happens if a woman is exposed to that. And certainly I would advocate that less is more when you're pregnant. And anything that poses even a potential risk, I think, needs to be discussed in depth with their healthcare provider. And I certainly don't want to give medical advice on a town hall, but I would certainly encourage anyone who has that question to really have a good conversation with their healthcare provider and talk about risks and benefits and alternatives to whatever they're taking marijuana for.
Okay. And I want to thank everybody for joining us tonight. I put the website link in the comments if anybody wants to read more about Celeste and her positions. Celeste, I'd like you to go ahead and close us out for the evening.
So I want to say thank you, everybody who's joined our town hall. Michelle, special thanks for agreeing to have this conversation with us. And I think that reproductive health is not just a women's issue, is a family issue. We want to make sure that a woman can make the decisions that she needs to make about when and if to have a family. And certainly when you choose to when you choose to start a family is a financial decision as well. And we want to make sure that women are paid equally, that they have equal opportunities in their workplaces, and that we have affordable childcare and educational opportunities for children so that they will later have economic opportunities. And it really is a holistic conversation and policies that need to be in place to strengthen families and communities. So I really appreciate everybody's time, and I will certainly add that I would appreciate your vote in November.
Thanks, everyone.